Hey everybody, welcome back to Drug Talk. This is episode 18. As always, I'm your host, Garrett Campbell. Today we're going to be discussing the medication known as methylphenidate, or more commonly known as by its brand name, Ritalin. With this particular medication, there is actually two other brand names that you can find methylphenidate in, these being Biphentin and Concerta, and we'll touch on these throughout the video as well. So methylphenidate is classified as a psychostimulant and is commonly used to treat ADD or ADHD, so attention deficit disorder as well as attention deficit hyperactive disorder. So methylphenidate or Ritalin is available in two forms, one of them being the immediate release form, and then as well there's a sustained release form. So the sustained release form gradually releases the medication over time, or the immediate release medication releases it all at once. The immediate release form is available as a 5 milligram, a 10 milligram, as well as a 20 milligram tablet. And with the slow release form, we usually see that as a 20 milligram tablet. This medication works by blocking the reuptake of a neurotransmitter known as dopamine. Now, before this medication is prescribed to an individual by their physician, there are some precautions that must be reviewed just to ensure that the medication is prescribed appropriately. Physicians will use precaution prescribing this medication to individuals who have cardiovascular disease. Now this can range from heart failure, recent myocardial infarction, or heart attack. It can be if somebody has increased blood pressure or even some QT syndromes. Caution will also be used when prescribing to individuals who have a history of drug abuse or alcohol abuse, because this medication does have the potential to be abused on its own. This medication may worsen the symptoms of psychosis. It can have a negative effect on hyperthyroidism. It must be prescribed cautiously in individuals with epilepsy, as it may decrease the seizure threshold. And finally, it should be used cautiously or sometimes avoided in individuals who have severe depression. Moving now from precautions to contraindications, or reasons that this medication cannot be used by an individual. Some of these commonly noted contraindications are anxiety or agitation, advanced arteriosclerosis, symptomatic cardiovascular disease, severely increased blood pressure. It's contraindicated in people who have glaucoma, patients with motor tics or family history or diagnosis of Tourette's syndrome, and finally, the use of a monoamine oxidase inhibitor in the last 14 days. Now, I mentioned at the start of the video that this medication is used in ADHD. It is reserved for patients that are equal to or greater than the age of 6 years old. I also mentioned that it comes as two forms, so the immediate release version as well as the slow release. These can also be classified as short-acting as well as intermediate-acting. The short-acting formulation usually lasts around 3 to 5 hours on average. The intermediate acting lasts 3 to 8 hours. There is a wide range here, but you have to keep in mind that there is variability between individuals. It is common to see people start off using a short acting version, which can be taken twice or 3 times a day, but depending on patient preference or physician experience with this medication, oftentimes people will be switched over to the intermediate acting medication. When the short acting version is used in adolescents, a typical dose would be 5 milligrams in the morning as well as 5 milligrams at noon. However, we can see doses all the way up to 20 milligrams taken 3 times a day. So the maximum dose here would be 60 milligrams daily. It's common to see adults start off at 10 milligrams in the morning and 10 milligrams at noon. And the max dose can go a little bit higher occasionally. I don't want to talk too much about dosing with this particular medication because, as I mentioned earlier, the dosing does vary from individual to individual. As well, there's a lot of different dosing strategies that can be used. For example, one strategy known as the kickstart and avoid noon dosing as patients use an intermediate acting alongside with a short acting tablet both in the morning. Or the rebound method, which has patients use a slow release version in the morning and then use an immediate release version in the afternoon. Now, when somebody is using this medication, there are some things that should be monitored during the course of therapy. Symptoms in general will be monitored at each physician appointment and preferably each visit to the pharmacy. If appropriate, academic performance may be monitored. Physicians will sometimes perform a physical exam on the patient. And then things like blood pressure and heart rate will be monitored as well, usually on day 0, day 1, and then about the 3-month mark. And then after that, every half to 1 year. Echocardiograms will sometimes be done as a monitoring parameter, but this is usually reserved for people who have a family history of cardiovascular disease, or if they're in a particular population, which would be deemed at risk. And lastly, some patients will get some blood work done periodically when they're using the medication long term. Now, if somebody is using this medication, there are some side effects that they may experience, so I'll list some of them for you now. Insomnia or difficulty sleeping happens in about 13% of individuals. 26% of the time you can see a decrease in appetite. Nausea comes in at about 12%. and vomiting at 10%. Weight loss happens about 9% of the time, and about 7% of people notice a tic. Emotional instability happens in about 6% of people, anorexia in 5%. Interestingly, nasal congestion happens in about 6% of people, and some people may notice some headaches as well. Some serious side effects would be angioedema, hallucinations, or blood dyscrasias. Now lastly, before I end off the video, I just want to mention 2 other medications which are still methylphenidate, just different formulations. So that will be Biphentin and Concerta. So these are long-acting versions of methylphenidate. Now to distinguish between the two, Biphentin has a multi-layered delivery system. This causes 40% of the medication to be released immediately, and then the remaining 60% to be released gradually throughout the day. Now Concerta has an osmotic release oral system, which causes 22% of the medication to be released immediately, and the remaining 78% gradually throughout the day. Biphentin usually lasts about 10 to 12 hours, and Concerta lasts about 8 to 12 hours. Now these long-acting versions can be more convenient for some people. It really just depends on patient preference as well as the clinical experience of the physician who's doing the prescribing. That's all we're going to talk about today with methylphenidate or Ritalin. As always, I appreciate everybody stopping by and checking out my videos. If you'd like to help the channel grow, you can like the videos, share the videos, or subscribe to the YouTube channel. Always remember that these videos are for information purposes only and not to guide you in making any decisions on your personal health care. If you have any questions about the medication, just direct them towards your personal health care provider. That's it for today. Take care.